Thank you for joining us for using the impact measures tools to support developmental screening in healthcare. We're looking forward to a great session. Now, I am pleased to introduce to you our speaker today. Please welcome Tyson Barker, PhD, Chief of Science and Innovation at the Institute for Child Success.
All right, thank you, Mary, and thank you everyone for being really brave attending a measurement and developmental screening talk at 4 p.m. But I hear the reception is going to be quite nice, so I'm looking forward to it, so you better go. How's that? Okay. So thanks again. I'm Tyson Barker. I'm a developmental psychologist by training. Early in my career, I worked in medical settings, primarily doing early intervention and early identification of autism and developmental disabilities. So I kind of come to a lot of the work in sort of this research practitioner model. In my career, I've been more in the research setting, much more in the applied setting, and I think in my role now I get to kind of take both of those aspects to how do we create innovative research-based tools to use in practice. And the reason why we do this is one of the areas where we see a very large need in the early childhood field and education in general is there's a lot of these technical concepts that we hear, you all probably hear in your work, reliability, validity, evidence-based program, evidence-based measure. It's a valid measure, right? The gold standard, RCT. So what we do, a lot of our work isn't this sort of research to practice, but how do we embed research in practice, right? So a lot of this is breaking down some of these scientific concepts and in tools that can be used readily in practice. And also in a lot of our work, we do a lot of human-centered design. So what I hope to hear from you in questions or after is I'd love feedback of, hey, here's how it could be more useful, these things that you're doing in my setting. Here's what's missing. Because we are in a very fortunate spot to have philanthropic funding to develop new tools for the field. So I have to, and all of us have to hear from you all, practitioners, providers, and how can we help you in some of these areas such as measurement and evaluation. All right, so first just like to thank a lot of our philanthropic partners who have supported and allow us to create a number of free tools and resources for the field. I'll show you the website in a little bit, but this is really what drives our work and allows us to kind of focus on field building work, which is primarily what we've been doing lately. All right, so the agenda for today, we're going to talk about developmental screening tools. What the heck is developmental screening? You hear it all the time now in healthcare. I'll talk about our impact measures tool, which is a website in which we have a lot of these assessments and screening tools. Then what we'll do is use our tool as an example to review a few popular screening tools that you're all going to know about that I hear in conversation a lot and walk through. What are the pros and cons? How do we think through choice? What are the needs for my community? How does it work? What are the needs in my practice, and how does that relate to workflow? And then we'll do a little bit of Q&A at the end. All right, so there are a lot of ways you can use developmental assessments, and there's a lot. So the way we have to say it, there's uses and then there's misuses. A lot of the conversations that we sit in are talking about how it's misused. We'll talk a little bit about that today. So first of all, when we talk about developmental assessments, I'm going to focus on healthcare. I'm not going to focus on early education because there's a few different uses, but I'll talk about the three main uses of developmental assessments, primarily in healthcare, and then how it relates to early intervention when we think of qualification for services, so referral linkage to services. So first, developmental screening, I'll define that in more detail, but we think of those as these standardized quantitative surveys in some way where we ask parents questions about their child's development. We ask adults questions about their own behavior and mental health and well-being. And what we do this is they tend to be a short sort of survey that allows us to know whether there's basically what we call a flag or an issue that we need to be concerned about with the purpose of further either referral for service or further evaluation. So I'll go into that in a little bit more detail. That's when we kind of call this developmental screening. Developmental surveillance, this is actually, the AAP has talked a lot more about this lately, is when we think of developmental surveillance is the ongoing monitoring of, during well-child visits of family and child well-being. So we may use a developmental screening tool as part of developmental surveillance. We may not use a developmental screening tool as part of developmental surveillance. But this is ongoing monitoring. So think of it as an ongoing process. The other terms that we often think of is goal concordant care. So how are we bringing families, talking about their strengths, where eliciting family concerns. These all kind of fall under this concept of developmental surveillance. Again, you can use developmental surveillance. You can use developmental screening tools as part of developmental surveillance. And the last area we often see the use is what we call developmental evaluation. And when we think about developmental evaluation, the main part we're really thinking about is, at least in the context in healthcare, is qualification for services in early intervention, particularly IDEA Part BC. So how do we use developmental evaluation to qualify for services? But it could also be used to inform program delivery. So it allows us to go deeper. So think of developmental screening tools as sort of kind of the tip of the iceberg, and then the developmental evaluations, this larger assessment allows you to go deeper. Best example, think of autism. I'll give the assessments here because we're not going to talk about autism assessments, but happy to talk more about that. But think of MCHAT, which is a very popular screening tool for autism. And the ADOS is the diagnostic evaluation, the developmental evaluation for autism. What we think of these two together, they kind of map and measure similar things, but the screening tool should tell us whether we need to do a larger ADOS evaluation, for example, and allows us to kind of understand the linkage of, okay, there's a flag, there's risk, and now we need to do this full developmental evaluation. And as I mentioned, we're going to focus on these two today. That's a whole nother talk on developmental evaluation. Maybe we can do that next year, Jamie. So we'll focus on developmental surveillance and developmental screening for today. And again, this is healthcare focused. There's other sorts of assessments we see in the early childhood field, particularly around something called a formative assessment, summative assessment. A lot of it's just terminology. You can kind of use them for similar things. But just so you know, there's others out there. And also we use research tools as well, measurement tools for research. But really, in the context, we're really talking about in the context of practice. All right, so whenever we talk about measurement and assessment, what we've really learned in the past few years is you can't talk about assessment without addressing the elephant in the room, which is how equity relates to how we assess and think about assessment. So there's a few things that what we've learned in a lot of our work as I tell you about our tool, and these are the things that we find, kind of these areas that we find are often ignored. When we think of assessments, the creation of developmental screening tools or assessments. So one is always keep in mind at a high level through this presentation when I talk about these tools is do not think of them in isolation. We want to think of them in terms of first, are the assessments, developmental screening tools, aligned with the community values? So every measure you see, every metric has values attached to it. There is no such thing as an objective measure. A human created it, right? They brought their biases. They could be good, bad biases to the development process, and those will always be in an assessment tool or measure. We bring our worldviews, how we think about kindergarten readiness, right? If you ask everyone in this room, we're going to have different definitions. So our values are often, and measure developers, assessment developers are going to bring those to the work. So how do we know those values are aligned to the community you're serving, their values? There's often misalignment in developmental screening tools in that area. Now this one has come up, the second one has come up a lot recently when we work with providers, practitioners, educators, does the community actually want to be assessed and measured? So this gets back to measurement has a very, very poor history, and it has been used in many ways to promote racism, sexism, and that measurement in and of itself doesn't, but again, how it's often been used has. So when you think of, and Brenda talked about this earlier, about trauma within communities, there is a lot of trauma around measurement and assessment, and we hear that a lot. So the first question is, does the community you serve actually want to be assessed? How are you using these assessments? Are you explaining them? How are you thinking about it? Do not think of the assessment in and of itself. It really is surrounded by your process in which you support families. And in and of itself, an assessment or a measure can actually continue to do damage. So you really, really have to be careful when we think through assessment tools and developmental screening in this way. All right, third one, I could go on equity and assessment for a long time. And this is another big one that we found, as we talk about our tool a little bit later, is language and culture matter. Best example we often see is you see a measure or assessment, and you say, well, if I need to translate it into Spanish, I find a translator, I just translate it, right? Doesn't work like that. If you translate a measurement or assessment tool, you have to actually validate it again. So you can't just translate and assume it works, right? The other part is culture matters a lot. Again, when we think of the values that we bring in creating an assessment or a measurement tool, that will be inherently in the measure. My favorite example, actually we're going to see two of these assessment tools I think ask this question, is I was working with an organization, an American Indian, a tribal nation out in Oregon, in Eastern Oregon, and one of the questions on one of these surveys we're going to talk about says, does your child walk upstairs? And the leaders of the program who worked on the tribal reservation said, we do not have any stairs in our community. This question doesn't even make sense. And also we're getting judged on it. Families, it's pretty clear, it's a yes or no. If you're putting no, it clearly assigns value because you're asking it, right? It matters. So that actually matters from a psychometric validation reliability standpoint. Yeah, it does. But it actually also matters from a human element and the relationship a provider is trying to have with the family. If you're asking questions, again, that aren't valued by the community or relevant, you have to be prepared of how those are impacting how you're interpreting the tools, but also your relationships as well. What we often see is good providers, practitioners, they're already adapting. They might actually skip that question, right? Or interpret the results with caution, right? So make sure to keep that in mind. And part of the goal of this talk is also just helping everyone kind of understand and realize that there is a lot of nuance here when we think of these tools. It's not this sort of, one tool works for everyone. It's the gold standard, but actually these things really matter and impact the way we interpret the information we collect and the relationships that we have with families. All right, what is developmental screening? So I talked about it a little bit at the beginning, a few slides ago. So developmental screening is the use of a standardized tool or tools to identify children at risk for disorders or developmental delays. If we drop the developmental word and we say screening, we also do that within a healthcare context as well with depression, right? So we do depression screening, postpartum depression screening in particular. But developmental screening is using sort of these brief tools, again, to identify risk. More broadly, again, this gets into the idea of developmental surveillance, it's a process of identifying concerns about development through partnerships with families. So how are we using those tools in a way to develop partnerships with families? It's not just, and again, it's in the word, it's a tool. It's not just a measure or an assessment. It's actually a tool to help you as a provider or practitioner in working with families in a strength-based way and developing those partnerships. It's only one piece of the puzzle, and actually there's a lot of data to support that. Actually, I'll show some of it today. It helps you understand where a child is, but it's really only one piece. The other part, there really is no perfect screening tool. We get this question a lot, is can you recommend the best screening tool? And I'm sorry, I always give a bad answer because I say it depends. What do you need? What's important to you? What's the context of your work? Those are the sorts of questions that I hope to kind of begin eliciting today, and as you all think of how you work within programs or in practice in these ways using these tools to begin asking these questions. Last, screening tools can help show how children thrive, children and families thrive. It often can feel like you're taking a deficit lens, but it's really important to see how do we take a strength-based lens when we use these tools. And again, in isolation, they can feel very deficit-based. But how do we elevate families? How do we think through this idea that we'll talk a little bit more about goal concordant care? How do we bring families in part of this process when we're using these tools? All right, so the Impact Measures tool is a web repository that we created, and I'll share the address, and Emmy actually talked a little bit about it earlier today. It's a project we've been working on for, 4 years now, where a little bit of the history was we were at a meeting where it was national home visiting models, national team-based care models, a lot of early childhood organizations were tasked with finding one perfect tool to measure social emotional development. And really what came out of a whole day of conversation, as you can imagine, if you have a conversation on what's the perfect tool, the question is what do we value, and what do we want to measure? And really what it came out was, it depends. It depends on the community and the context of your work, depends on the goals of the program. So we came from that meeting and said, why don't we actually make a website that lists all these measurement tools in a meaningful way to help practitioners and providers be able to kind of sort through these sorts of questions of what do I need, what can I use, and what would fit for my community. So it's as I mentioned, it's a free database of early childhood and parenting assessments. You're able to search and compare. When we do this virtually, we share our screen and we can walk you through the website, but for a more interactive presentation, we're not going to do that today, just a few screenshots. The idea is you can kind of find these high quality assessments, developmental screening tools that work for different communities' contexts. And we also have educational resources about going to the simple, what is measurement, to more complex, what are the different purposes of measurement, how are they used, and other sorts of tips and tricks as well. So definitely check it out. And the idea is these tools and resources, again, as I mentioned, are free resources to the field. And as always, if you have ideas of things that we should include, feel free to talk with us, things that would help you in your work. So again, that's what we hope to provide for the field. All right, so if you go to our website, so I'm going to unpack this a little bit. What we've done is we have about 300 different assessments on our website. Some are developmental screening tools, depression screening tools, developmental evaluation tools, as well as parent mental health and well-being, classroom quality, childcare quality. And what we've done is we've reviewed the materials and the manuals from all these measures and pulled out all the information and the characteristics of these sorts of measures and assessments. And we also did some interviews with researchers and providers to understand what are the things that are important to you when you need to choose an assessment. And the 4 things that came out were cost, usability, cultural relevance, and technical merit. So I'll unpack all of those in a little bit more detail. And so what we did is we developed this scoring system where we rated these tools from 1 to 10, 10 being the highest, 1 being the least in terms of the strength across these 4 areas. And then what we did is we created this diamond to help display the scores. So the scoring diamond visually displays the assessment or developmental screening tool in each of these categories. So in the yellow, you can see. So in this example here, if you kind of look at cost, for example, it's right in the middle on the cost. If you look on the left side in technical merit, it has a higher score in technical merit. If you look in the usability side, it has it has a very, very low score. It's a 0. So the kind of the shape allows you then to say, okay, where is it strong? Where are these tools strong? Where are these tools weak? So in this example, the cost, technical merit, cultural relevance are quite strong, and the usability is quite weak. And now this is the coolest part, because I didn't even know this was possible, but we did it, was you can actually set your preferences on the website. So we ask you, okay, you rate from 1 to 10 on these areas, and the purple line represents your, what we call your preferences. And the idea is then the assessments are reordered based on your preferences. So again, it's not about what's best, it depends what you need. So in a lot of our work, when we provide technical assistance to organizations looking for assessment tools, what we do is we run through activities and to understand how do you all think about these 4 areas. Is cost, how important is cost to you? How important is cultural relevance? How important is usability? And that allows you to sort of look and search for these assessment tools in a meaningful way. And it also forces you to choose and to align around what's of value. All right, so next what I'm going to do is break apart the 4 scoring categories in a little bit more detail. So first, how affordable is the screening tool or the assessment? A few things go into our score on that. Primarily is price, so how expensive is the tool? Just so you know, it's really hard to figure that out. Most measure publishers don't want you to know that, and there's different pricing depending on how many you're purchasing. But we try to do our best to get an estimate of the cost. And accessibility is the information or the tool available for download on a website. Some tools are. Do you have to request it? Where do you have to purchase it? That sort of thing. Tricky thing with cost is a higher score in cost means it's cheaper or free. A lower score in cost. So it's kind of the opposite. So a high score, a 10 in cost means it's free. All right, usability. So when we created usability, we actually pulled a lot from healthcare and implementation science. And there's actually a good bit of research around what makes a usable measure. One example I often give is it was a colleague of mine who's a social worker, and we were doing a project. And it was I'm a trained researcher, so I had to include all these assessments. And he said to me, there's a rule, no more than 5 minutes for all your assessments. And that actually really stuck with me. Okay, that's what I have to work with. And time really matters in the context of a lot of your work. So some of the other parts that we came up with, so time, how long does the assessment or screening tool take? Training, do you have to attend a webinar? Do you have to get a certificate? Interpretation, now this one's really important. Is it actionable? Does it give you actionable information when you complete the survey that tells you what to do? Screening tools are great at that, right? They can tell you, is this a concern or not concern? You add up the numbers, it tells you something actionable. Not all assessments or screening tools are like that, but a lot are. And then the format, is it pen and paper? Are there digital versions, web-based versions? There's lots of different ways in which assessments, developmental screening are trying to be integrated in electronic health records in various ways. Other sorts of digital tools where you can fill these assessments online. We try to capture that within this format question as well. So think of the way I think of it is usability. If you think of an assessment, how usable it is. A 10 means that it's very, very usable, probably takes you 2 minutes, 3 minutes at most, very quick and easy, and it's interpretable, gives you great information. Developmental evaluations are notorious for having low usability, requires an hour, a trained clinician to administer with a family, lots of training on the assessment. So you can see you get a wide variety here. And typically the lesson in healthcare is you really got to have a 7 or 8 or above. A lot of the screening tools are 7, 8, or 9 in our scoring system. All right, cultural relevance. This one is very, very underappreciated. How well does a screening tool or an assessment serve different groups? So different groups, different race, ethnicity, different language. So what we did in this is we looked at the demographics. So when an assessment tool was created, okay, when they validated this tool, when families or children were administered, what were the race, ethnicity? What were the gender of the children? Do we have this information? Why does that matter? It matters because if you validate a tool in only one sort of sample, say it's predominantly, I'll give you a great example. There are some screening tools that have been developed in Oregon in college towns. Now, if you were to administer that in South Carolina, would that tool still be valid? There may be cultural differences in those questions, right? So it may be valid in one spot and not another. So in our demographics, what we look for is region, urbanicity, race, ethnicity, gender, and we're able to kind of get a sense of the demographics. The idea is if you want a tool that works for everyone, you got to include a sample of these various kind of attributes that are relevant in the U.S. Bias in the measure. So this is a little bit nuanced. There's a few different ways we think of biases, but you can actually have a bias in that certain families of a certain race ethnicity might respond differently to a question. They may interpret it. Best example of a bias in a measure is the steps question, the stairs question. That's a measurement bias. Doesn't mean they're biased in a bad way, but it means that the way in which certain individuals respond, and in this case it was American Indian families in Oregon, to that question makes that survey item about does your child walk up steps irrelevant. Bias in the process of the creation, sort of in the same sort of area. We also look at what's really important, were families included, and sometimes providers, practitioners included in the development process. My favorite example, I always talk about an assessment tool that was created to look at, actually it's a healthcare measure, looking at families' experiences in healthcare. So when they were, Family Voices is the organization that developed this tool. So they wanted to know what was important in terms of these experiences in a healthcare setting. So what they did is they interviewed families and then did qualitative coding to find themes and then developed a quantitative measure based on those themes and those questions. So in that case, they actually, and then those are the surveys that are administered to families now in that context to understand their perceptions of and their interactions in a healthcare setting and their perceptions and comfort in that setting. So what you can do in that way is, are we bringing in those who, again, the earlier panel talked about it, lived experience, or those who are closest to the problem or those experiencing the service in the design process. All right, technical merit is the one that you hear the most about. And this is, we do it last because it's the one everyone thinks of first. Developmental screening tools are a little different, but typically what we think of a technical merit is you hear the term, it's reliable, it's valid. We say valid, it's measuring what it's supposed to. Reliability means it's stable over time. That reliability is sort of this consistency, accuracy. We use the term accuracy for validity. But in developmental screening tools, or in screening tools in general, the two concepts that actually mean the most are sensitivity and specificity. And sensitivity, we think of the degree to which a assessment tool or a developmental screening tool accurately diagnoses a condition. So usually it's from 0 to 100. So 50% would mean 50% of children who screen at risk for a developmental, on a developmental screening tool have the condition they're screening at risk for if you do a larger developmental evaluation. So specificity is the degree to which it's actually capturing those who have the condition and aren't. The easiest way to think of it is those who aren't captured into who don't have a condition or developmental disability and aren't screening positive. So these two actually have trade-offs. So when you make a screening tool, and this is going to get into our conversation, you actually have to weigh these, is how much sensitivity do you want? Do you want kind of this wide cast of detecting risk, or do you want to have it narrow and make sure it's really only, it's not what's kind of like a false positive. It's not capturing risk of children who have healthy development or adults who don't have, do not qualify for services or don't need a developmental evaluation. So screening tools always have this conflict, which is very unique to these sorts of tools. You don't have in other assessments. In other assessments, you really just think of it in terms of these other characteristics, and in terms of reliability, validity, how strong the tool is. And you're always kind of aiming in one direction. So unfortunately, in screening tools, it doesn't work like that. And the developmental screening tools I'm going to show you actually are designed to have different sensitivity and specificity. And again, it depends on your needs and your context. All right, so anyone who works in healthcare, primary pediatric care, are going to know probably most of these three. I'll start with the most popular, and Ages and Stages questionnaire actually is used in early education as well. Head Start uses it a lot. So I'll walk you through that. So here are the scores. So what we've done is we read the manual of the ASQ3. We scored the ASQ on these 4 areas: cost, usability, cultural relevance, and technical merit. And this is how it did. Cost, a 2 out of a 10. So that means it costs a good bit of money. Usability, it's pretty good, 7 out of 10. So it's a pretty usable developmental screening tool. Cultural relevance, not so good, 4 out of 10. As a side note, most of the assessments on our website score low in this area. It's a general weakness of the early childhood field in these assessments. And technical merit is pretty good, 6.5 as well. All right. Another popular one that we see, parents' evaluation of developmental status, PEDS. PEDS is a little bit different. ASQ is a caregiver report measure of development. PEDS is actually a parental concerns measure. It actually directly asks parents of their concerns, whereas ASQ just asks more on developmental milestones. So it actually is quite different. Cost, so we scored it a 4 out of 10. It's a little bit cheaper than the ASQ. Usability, a little bit lower, but still pretty close. Cultural relevance, a little bit better. Technical merit, pretty close to the same. So these 2 tools, developmental screening tools, function in a similar way. The questions are a little bit different, but kind of those characteristics are somewhat the same. All right, now this is the best because it really throws it all out the window of a totally different type, is the SWIC, the Survey of Well-Being of Young Children. So the SWIC is a newer-ish developmental screening tool that takes a very, very different approach. It's about being very, very short, and it's about casting that wide net. It's okay if we have false positives. It's okay if children screen positive on that and who may not actually qualify for services later. That's how it's designed. And it's absolutely free. You can download it all on their website. So it's a free tool, great usability, cultural relevance, not so great, which is a general weakness, as I was saying. And the technical merit's not as good. It's a really brief tool because it's really meant to be a very high-level screening tool. So again, going back to that first question of what is the perfect tool, if you look here, you can just see there's a lot of variation in sort of these strengths and weaknesses, how long they take, their technical merit. What's not captured here, the sensitivity, the casting the wide net or the narrow net. So there is no perfect tool. It really depends on the context. Are you a provider that has team-based care? You might have more time and opportunities. Real providers, it might make more sense to do the SWIC, for example. Maybe you don't have a lot of time. We'll get to a little bit in a second is then how does this align with service for a referral to services, linkage, and qualification for early intervention. Those actually matter. How do these map on to qualifications for early intervention? They're all slightly different. The flags don't map on to specific EI criteria. All right, so again, thinking about the purpose of these tools, how do you plan for a developmental screening tool to be used for developmental surveillance, goal concordant care, supporting families, elevating families? And in the absence of having thought through that, there is a few things can occur. One is, do you have services to refer to? There's actually some work done that ethically is an issue if you're screening, you're having flags, and children are getting flagged on these screening tools. If you don't actually have services to refer to, it could be considered unethical. The other part is this idea of goal concordant care. What are the goals of the family? What are the goals of parents in their children's development? And how are you elevating those strengths? And how are you talking about children's development with these strengths? Part 2 is how are you asking about parental concerns? Some assessments, like PEDS, for example, is sort of eliciting that through the survey. The SWIC does this as well. Others don't. But how do you go about doing that and talking about the way? In isolation, the measurement tool, the developmental screening tool, doesn't help provide that story for families. And we see that as a huge issue with how we contextualize developmental screening. And I think the big part is, how do you think about it in terms of false positives? So children who in a developmental screening tool are flagged at risk for needing a later developmental evaluation or another sort of evaluation or referral for services. And how does that actually relate to your available services in your community? Part two, how does that actually relate to the qualification of early intervention? And again, these tools do not align. They were not developed in that way. They're developed to maximize sensitivity, specificity, these other sort of characteristics. So it really requires professional judgment and to understand and collect information on how you are referring families and whether they're also qualifying for services. The best example I can give is state of Oregon, where I'm from, in the past 5 years or so has done a very concerted effort to improve developmental screening rates in the state, and has done an amazing job, mostly due to one individual at Oregon Health Sciences University who's really promoted it. However, the promotion of developmental screening actually had an unintended consequence in that we had a lot of providers screening, and when you screen more, you're going to get more children who are flagged, who are getting referred, but those children were not qualifying for services based on the assessment, one of these that was being used. What did it do? Early intervention providers were getting upset because families were coming in and who were just getting denied. What would happen is they would keep getting screened at different well-child visits and get referred again. And it was actually, what was happening was hurting relationships between early intervention providers and families, as well as early intervention providers and healthcare providers, because there was no kind of linkage between understanding that referral process, how that assessment was being used. So one takeaway here is developmental screening is very important, but you have to think about it in the context of your work in the larger system, because it can have unintended consequences. All right, sensitivity. Not all screening tools are created equal. So going back to the Oregon story, this is kind of getting to it, is we need to think through this net, sort of casting the net. How important is it that we capture families or children who may be at risk for a developmental disability, who then actually have a developmental disability or and qualify for services? So in this study, that I'll show you really quick some of the results of, what they've done is they looked at the 3 tools that I just showed you, and they looked at the sensitivity of these different assessment tools. And they split it up by younger children and older children. I'm just going to show you the results for the younger children, and as well as between different disability status as well. So in this study, what they did is they had families complete these developmental screening tools, and then they conducted the larger developmental evaluation. And they looked at the degree to which the screening tool actually predicted the results of the developmental evaluation. Going back to the MCHAT, so risk for autism, we do the MCHAT. And how often is the MCHAT right? When we think of the larger ADOS autism assessment, right? 100% means 100% children who are flagged on the MCHAT ended up meeting a criteria on the ADOS for an autism diagnosis. So think of this through all these assessments. All right, so for severe disabilities, we see different sensitivity of those screening tools. PEDS being the highest and ASQ being the lowest. So we have 80% of the children who were screened at risk on the PEDS met criteria on a larger developmental evaluation. We had 70% on the SWIC, 60% on the ASQ. First of all, those if folks don't know or don't follow kind of these screening tools, the percentage is actually kind of a bit lower than most people think, right? So you would think these screening tools would have a higher rate. That's for severe disabilities from 0 to 42 months. And look how low they get if you go mild to moderate, which makes sense. They're going to be lower, right? Because our threshold of where we're trying to capture is different. So the PEDS and the SWIC have a lower percentage, 60% for the PEDS and the SWIC if families complete that developmental screening tool, that they actually meet criteria on this larger developmental evaluation. ASQ is 50%. A few things to note here. One, if you ask parents their concerns and you say ASQ plus parent concern or parent concern, PEDS and or parent concern, SWIC and or parent concern, all the percentages go up, right? So a lot of times, again, developmental surveillance eliciting parent concerns, when we think sort of these numbers, they're very influenced by the degree to which we actually elicit and ask parents, do you have concerns about your child's development? Part two, the big point, not aligned to EI eligibility criteria at all. These are the developmental assessments. Every state has different criteria, different percent thresholds that you have to meet. So these actually might even be influenced as well. In the Oregon example, best example was children where families were completing one of these surveys and were getting screened on the social emotional development on that survey. And they went over for EI evaluation and were always denied because the criteria in Oregon wasn't mapping to one of these assessment tools. So they were getting flagged in one of the domains, but that domain wasn't programmatically allowed to provide services based on the developmental evaluation. So we had misalignment there. In terms of implementation, do you provide, as I mentioned before, these assessment tools and developmental screening in isolation can do damage and can hurt your relationships with families. So how do you talk about it? Great example, I was talking to a colleague who only knows about some of these assessment tools, was the ASQ because he works in the area, but he had his daughter came home in her backpack with the ASQ with no information about what it is, what to do with it, what it means, how it will be used. So how are you actually providing information to families about giving the context? How is it going to be used? Is it used in a strength-based way? Going back to the stairs question, imagine having no context, seeing that the stairs question, and you don't have stairs in your house, your child isn't walking upstairs. Am I being penalized? Is my child, is there a developmental issue? You have to provide that context. How do you discuss the results? Again, that's really important. How do you align it in terms of this idea of goal concordant care? What are the goals of the family? What are the concerns that families are bringing to well child visits? And then the last part, language and culture matter. Some of these tools have been translated and validated in other languages. Others haven't. We have information on our website, what language versions are available. But what often happens is, do you need to adapt? How do you adapt these developmental screening tools if you need to? How do you take that into consideration when interpreting? Again, the stairs question. Do you ask it? Do you just say, I'm not going to consider that result? That question when a family fills out the survey, you need to take those into consideration. The best example is, and sometimes we've gotten pushback on this idea of adaptation. If you adapt it, it's not the tool that it was meant to be. You've ruined the reliability and validity. Well, what you could also say is that question doesn't make any sense, so it isn't valid in that context. So they're all pros and cons you have to weigh. So an adaptation, you kind of want it to be close to what it is. But if the example we always give is, this has happened a lot, the survey or the assessment does not make sense to my community. If you ever hear that, it probably means it's also not being used in a way that's valid for that community. We can't interpret the results. So please take into consideration language and culture when interpreting. All right, so you can find out more information about our impact measures tool at this website, ecmeasures.instituteforchildsuccess.org. We have about 319 assessment tools and developmental screening tools up there. We also have resources, as I mentioned, educational videos, other sort of content. And what we're currently doing is developing kind of what I just did today, more personalized, curated content based on your sector system or where you work with. So developmental screening tools in Head Start, for example. So how do these screening tools need to be used in the context of regulations for Head Start? And we hope to be doing that within healthcare, on a federal grant, a federal HRSA grant that we're involved with. Developing sort of these tools in the context of health systems is our next goal. So, and please connect with us. As I mentioned before, if there's tools, resources, questions based on your work, hey, you know what would be helpful for me in my work in understanding developmental screening and what I've done, please talk with me after. It's really important to us that we kind of have this kind of feedback loop where we're able to take in information, change what we're doing, provide new resources. All right, so I'll open it up to questions, and we'll see if this even works, because it didn't work in the other room, but we do have a brief survey. So the way I say it is we're able to offer this free resource to the community based on the generous support from a number of foundations. And in return, what we ask is to collect some data about what you've learned or your experiences and your information. And that allows us to continue to have these tools as a free resource to the field. So I'll pause here for questions, and if it doesn't work on the survey, please let me know. I think we might have another spot we can send it out as well. All right, well, I'll pause here if there's any questions. Yeah.
Here, Dee, I'm going to give you the mic so everyone can hear you.
You said that I think the developmental screenings should not be done if services aren't available to meet the needs. But aren't developmental screenings sometimes used to make the case to have services brought in?
Ooh, good question. I'm curious anyone else's thoughts who've worked in a health context in that. What I've heard from providers is they are very uncomfortable in their work administering, these are in Oregon, this is my experience, administering developmental screening if they don't immediately have services available and they don't have a mechanism by which in their community to support the families. With that said, I think that's a good point. It's like, how do you collect that information to make the case? And I think that probably gets back to that other talk about collecting, that's kind of that collective impact. We could actually collect data on that. In a meaningful way. But there, in many of my experiences, there's often resistance from providers in that case. Yeah. But great question. But if anyone else has, or if you have thoughts on that, I'd love to hear it too. But you probably, yeah.
I had a second question, and
Yeah.
that is, in most cases, aren't parents supposed to be informed or give consent before their children are assessed?
Correct.
Yeah.
Yeah, and I think the nuance there is and you've worked in the field, there's a difference between signing a consent form and making a parent part of the process. And unfortunately, what we often see is not just screening tools, assessments in general. I'm guilty of this as a researcher. Just sign the form, here's all how, and not really like taking the time to explain how the information is used. So thinking of it as like consent as like there's like the consent, but also the process of building a relationship through that. Yeah.
It bothered me as a parent. My child came home with, an ASQ score and everything, and I didn't even know that it had happened. So
Yeah.
That was sort of my point.
Yeah.
So that's a great question. And the irony is the person who developed the SWIC, who you and I probably both know, actually wrote an article about the ethics of screening when there weren't services. So she had definitely thought about that, but that was years before developing this week. And there's a couple of components to that. Years back when we started a program here to promote developmental screening before Help Me Grow, it was about, it would have been 15 years ago, we sort of got into trouble from our early intervention providers as well, not into trouble, but it was like, gee, we already, we have, don't have the services already, and now you're going to be identifying more children that we can't serve. My sort of snide remark was, well, if we don't know they're out there, how are we going to advocate and the like? I think that, when we talk about developmental surveillance, it's not only identifying the problems, but engaging the parents and the family in a conversation around their child's development, that they understand it better, that there we could at least recommend activities to be done at home with a child, even awaiting services that are going to help that child's development. So I think there's so many nuances and there are no easy answers, and that's why I thank you for your presentation, because this is, the more you peel this onion, the more complicated it is, all the way to the fact that the ADOS itself is actually pretty subjective.
Oh my gosh, yeah.
It's not a gold standard.
Oh, I'm trained
I
on
wish
the-
we had
yeah.
blood tests.
Oh yeah, I'm trained on the ADOS, and let me, one of the questions is, my favorite is, you get points for blowing out the candle in the birthday cake, right? So, oh gosh, and we'd have debates of, does that count? Did they get a point for that? Did they do that? But to your other point on developmental surveillance, and there's also this idea that the tools are designed, and this is something that has come up a lot with some of these, is not as a referral mechanism, but as you're saying, just like it's like a training tool. It's essentially boiling things down for you to engage with parents. So you don't even have to use it as that mechanism, to your point, right? Like, it doesn't need to be used in that way, but you have to frame it quite differently. And I will say, if you look at the sensitivity rates, it's basically telling you you are using it as a training tool and as a surveillance tool. Because if you use it in isolation at those rates at 60%, that's not very good. So yeah, again, I think it's, really trying to understand that context. And again, it's, you think you solve one problem and you've created another. Again, that earlier presentation, collective impact, it's all about that. If you don't understand the system in which you're doing, help me grow, this is what they do, right? And I think the point here is that even those sensitivity rates and the screening tools actually influence that.
I would argue that well-child care is screening. I mean, every time we put a stethoscope on a child's chest,
yeah.
and we hear, was that a murmur? I'm not sure that was a murmur. Do we just watch it? Do we send them to a specialist? I mean, so I don't really, I think it's an unfortunate dichotomy that we've separated development from the physical well-being. And I think we need to, so I don't have, of course, I'm biased as a practitioner. I don't have any problems with identifying something that I might not know quite now what to do, much like I would do when I feel a child's stomach. Is that a kidney tumor or is that just stool in there? Do I send them for ultrasound? Do I watch them? So we're going through this process the whole time, and I think we need to think of it in as not separate.
Yeah, oh, I appreciate that. And what you just said was that I think the takeaway of making this tool was, then what? Like, how do you contextualize it? And in isolation, when we read these articles, it doesn't describe anything. You read the validation studies, it doesn't say what you just described. So the question is how do we as a field help people understand that or develop those processes and not just, get in the habit of, it gets flagged and risk or not risk and that nuance. I'll give you the analog, and this was kind of as I was making this presentation. That's what formative assessments are in early education. You're using it as a training tool for early educators and as a way to monitor development in an ongoing fashion. Why can't we just think of screening tools in that way as well? For some reason, you start talking about sensitivity, specificity, and it moves you. And a lot of it's just the incentive of we see this in the field in general, the numbers end up driving the design. So as opposed to what you just described, this process driving the design of the screening tools, unfortunately. But providers, educators, you all adapt. Everyone's very good at that if you work with families, and you adapt in ways to help kind of accommodate for the lack of the personal connection and ongoing surveillance as you're describing. All right, any more questions? All right, well, thank you so much. I really appreciate everyone's time.